actually got some time for questions, so who wants to kick off? Right, there's a lady there. Do you need a mic or are you happy with that?
I've got a loud mouth, I've got 4 minutes.
Excellent.
Right, for the lady who's just produced, I actually found that the most beneficial for myself. My son actually suffers with autism, has a lot of other issues, and he's ADHD, and the problem I'm struggling with at the moment is the current medication he's on is not working. The CAMS team have acknowledged that that's not working, but they're still giving it to him. If I go back with the information that you've got, would that sort of support me to try a different route with him with regards to, he's still high for activity in the morning, he's wired from the minute he gets up at 4 a.m. You know, even with the medication, it helps him concentrate at school, but it doesn't help because I said it doesn't help with the autism side.
So one of the
Make it worse.
Yeah.
The one that he's on.
Yeah, so it is always worth having a discussion with the clinicians and asking for an opportunity for a thorough review. One of the things that's really important, and that I didn't perhaps touch on, is none of the interventions for ADHD, anxiety, or non-compliant behavior are going to reduce autism themselves, and that's always going to be in the background. What you're trying to do is decrease the additional problems. Getting the right intervention, whether it's psychological or medication, often in children with autism does require quite a lot of thinking carefully about the child's presentation in relation to the different domains: autism, ADHD, anxiety, and in addition, medications can sometimes cause adverse effects. Children with autism are more likely to have adverse effects. So it's always worth asking for a thorough review, and perhaps even an appointment when you see the clinician without your child, so you can think about things perhaps without being disrupted.
Yeah, that was really recently, and so we've got to wait another year for the next one.
Chase them and get that good lady next to you.
Thank you. You've all spoken about...
Yeah, you pass the mic along.
Thank you. You've all spoken about working with parents. Now, my child was taken into care and he doesn't have an intellectual disability. And what I experienced in the care system, I found was pretty shocking. So my question to you is, do you see many looked after children? And given the adverse experience these children, many of them have at a young age, and the prevalence of emotional and other problems that this group have, which is over 60 to 70, 80%, depending where you look. What do you think about that? Do you think there is a large area of unmet need, and how would you change that?
Who wants to kick off with that one? It must be one of the biggest questions facing us as a society. Emily, you're up for that one.
Shall I kick off? I think it's a really important question. What I would just start by saying is that clinicians and those writing guidelines are very aware of the need to think specifically about the special needs of looked after children and the different ways in which they may present, and the fact that often mental health problems may go unrecognized in that group. So, for example, the ADHD guidelines that is just started again has highlighted as one of the special groups it needs to think about as being looked after children. So it's a very complex area, but I think there is an increased awareness that the interplay between environmental adversity, as we would call it, and the child's own characteristics needs careful teasing out to get the most appropriate interventions for individual children.
And are you seeing much good practice? Are you seeing many looked after children?
So in my clinic, we see quite a few for a second opinion in relation to diagnosis. But I think there is, in general, a recognition that we need to think more carefully about this, about looked after children and identifying their individual needs.
And do you think? Sorry,
I think we need to move on. Otherwise, I think you should nab Emily at lunchtime. Right, Mayor.
Well, I was just thinking, from personal experience, I've had lots of mental health problems and I have autism. I never found cognitive behavioural therapy at all helpful, but I did find dialectical behaviour therapy very, very helpful. I was wondering if any of you had heard of any studies or are currently doing any studies that are looking into the effects and possibly the outcomes of dialectical behaviour therapy with children with autism and mental health problems.
I can say something. So there is certainly an interest in using DBT with both adolescents and adults who have an intellectual disability as well. And although not really robustly designed studies, some sort of data to suggest that it might be helpful for some adults and adolescents. There is some work that is also going on focused on children and adolescents looking at using DBT skills in a broader kind of mental health and well-being context. So, for example, there's a program in the United States that's been developed for teaching DBT skills to help with emotional regulation in the context of school settings. And there are some researchers in North Wales starting to explore adapting that program to support young people with autism in a secondary school setting. So not necessarily those who have already a mental health problem as well as their autism, but helping them more generally, that population in that setting who are obviously at quite high risk for mental health problems. So there's kind of work going on.
It's worth saying that no single approach has been shown to work for everyone. It doesn't matter what you're talking about, whether it's drugs or you've got to find the thing that works.
This is a question for Andrew, because obviously you haven't really asked a question yet, so I thought obviously you don't want to be left out. Might be a bit difficult answer really, but CNVs, how do they occur? Are they spontaneous? Are they... So, looking at sort of environment again, sort of epigenetics and things like that, how does it happen?
They're, compared to a lot of other genetic sort of changes, they're relatively new in terms of where they've been discovered, but the vast proportion of them occur spontaneously. There are parts of your chromosomes that contain bits of DNA sequence that are very similar to each other, and when they come close to each other, they can interact. And the bit of DNA in between the two gets lost or can even be duplicated as well. That's why we're interested in parts of chromosomes that double up rather as opposed to being deleted. So there are things that occur spontaneously. The majority occur spontaneously and are not present in either of the parents. They may have their own CNVs, which are undetectable. They vary hugely in size, but the larger ones are the ones that remove or double up more genes and are more likely to have an impact on the way the brain develops, and then there's the neurodevelopmental consequences of that. Some of them are present in the population and are inherited because they're tolerated, as it were. There isn't a kind of a selection against them. In other words, people can grow up without any obvious symptoms. A lot of those CNVs, including the one I talked about in their young child, who, that wasn't his real name, by the way, it's almost certainly in one of his parents, based on the anecdotes, even though they've not been tested. So they're survivable, and the parents can reproduce. So those are the 22q. Very few people go on to have children. So there's a kind of a selection against, which means they're continuously being generated in the population. It's just another facet of the complexity of our genomes, really.
Great, thank you.
Hello. I'm at the back, a long way away. I'm here as a parent. I've got a 10-year-old son who's got many diagnoses that seem to get added to every time I visit a doctor. He's got exactly what you were describing earlier. It was like you were describing my son in the first talk. So he has ASD without the repetitive traits. He has ADHD without the H. He has anxiety, depression that's suicidal. He wets. He has dyspraxia, dyslexia, sensory processing, sleeping problems. I also have bipolar, so they're keeping an eye on him to see if he also has bipolar. What I didn't get from your talk was, if you have all these things, lots of children with ASD have a wide variety. What's the worth in asking your paediatrician, is this something that's worth looking at genetically and being genetically tested? I live in Cardiff and they don't have any funding for very much at the moment. So CBT's a no-go. Medication, he can get weighed and measured and have some medication, but that's about as far as we get, apart from being offered another diagnosis of something else every few months.
Well, as I said to the family I talked about at the beginning, they had shared the same sorts of frustrations, but actually having a piece of paper that gave some kind of indication as to why their son had these problems was enormously helpful, even if it didn't have any impact on the way he was going to be looked after, unless and until that information later down the line in years to come tells a little bit more about the biology and what might help him. And they wanted to get involved with research so that we could understand biology, which might lead to changes in treatment and better services, etc. You're right. I mean, access to sort of services that might produce a genetic test result and what might fall out from that is very, very difficult. And at the moment, NICE recommend that children with autistic spectrum disorder aren't referred to genetic services unless they have significant comorbid features, which usually is a physical anomaly or learning disability. And there are potentially huge numbers of people that could be referred that aren't, where arguably a genetic investigation might be helpful because it may identify other high risks, other problems that may be down the line, or it may identify other people in the family who could benefit from that information in terms of making their own choices about children and reproductive choices and having testing, et cetera, et cetera. So it is a big challenge, and Cardiff is as challenged as most other centres, both in terms of funding and in terms of the way the guidelines are. But we are actually working very closely with Clinical Genetics in Cardiff in a collaboration to actually improve access to genetic services for people with ADHD and autism. So there is progress being made, but it's done in sort of off the side of the desk, as it were, rather than with formal funding. But that might change if we produce evidence for patient benefits. So we're optimistic, but it's going to be a long, difficult process.
Depressing. Caroline.
Hi, I'll try and be quick, but I've got a little boy who's 7, and he's got complex needs as well as no speech, as well as ADHD, and they think autism. And he's a beautiful little whirlwind, and I love him to pieces. And they medicated him for his pain, which completely sort of shut him down. He withdrew, this lovely, even though they've said autism, he is a lovely, happy, sociable boy who suddenly just completely withdrew from everything, from class, from communicating. He'd come home, he was tired, he'd cry. And the kick-off for this is, yes, that's really hard for him, and the people are right, there's no support. I've come from Lincolnshire today, and there's diddly squat down there. But there's even less support for the siblings, which Richard mentioned, his first person I've heard that done it. I have a 10-year-old daughter, and actually it's her that I'm worried about on the mental health side, because she is turned around the other week, so I'm just struggling with life. Dad's had a brain injury, Alfie's like this, whew, blown away, but there's nothing for her at all. There's no young carers, there's no peer groups, there's nothing. And when you phone them up, you come up against this brick wall, and she's really struggling, bless her.
No question, that services are disgraceful. Richard, do you want to pick up on it?
I might pick up on the siblings thing for 2 reasons. One, because I think it's very clear that parents worry a lot about siblings when they have a child with disability, and that's kind of a reasonable thing to do. The kind of reasonably good news is that although it's pretty clear that siblings in a family of a child with disability are slightly more likely to have psychological mental health problems themselves, it's not massively different than children generally when they're siblings, because the interaction with your brother or sister can be generally kind of both positive and distressing.
Yeah, it is quite physical.
And there are some added features of having a disabled brother or sister, but being a sibling is also kind of difficult and positive as well. Secondly, not only are there problems, but there are also kind of positive benefits for siblings. That doesn't take away the fact that there are a small group of siblings who perhaps have additional stresses alongside having a brother or sister who has a disability. So, for example, if the brother or sister also has quite significant levels of challenging behaviour, or as you're kind of describing, maybe the parent has a physical or mental health difficulty, or both do, then those are the kinds of things that add additional stress for siblings. And so have you heard of the charity SIBS?
Yeah, I did phone them and they said, oh, we can't because you're not a group, come out and teach you anything. But this group's got something, and I had to really kick off and I'm quite quiet and don't normally, just to get her on that. So she could have that.
They're a very small charity, but for some of their online resources are really helpful for, especially for young siblings, and now also for adult siblings as well, actually, if they're kind of setting up groups too. So very, very small charity, very specialist charity, but worth looking at their website and the materials that they have.
Thank you.
Lady here, do you want to respond?
I just wanted to